Did you hear?
Hear what?
The new girl has gonorrhea.
What? How did she get it?
Let's talk about what sexually transmitted infections really are, how they are transmitted, how they are cured, and more important, how to prevent them. STIs are infections that are spread predominantly by sexual contact, including vaginal, anal, and oral sex. Some STIs can also be spread through non-sexual means such as blood or from mother to child. Some are bacterial, some are fungal, some are parasites, and others are viral. The most common bacterial STIs are chlamydia, gonorrhea, and syphilis. They usually don't have symptoms, but chlamydia and gonorrhea can cause unusual discharge from vagina or the urethra. Both of them damage the reproductive system if they are undiagnosed and untreated. Fortunately, they can be cured by antibiotics if diagnosed. Syphilis is also a bacterial STI and doesn't show symptoms either most of the time. Syphilis has several stages. In the first stage, sores can develop in genitals, anus, or mouth, and they are infectious. In the second stage, people might get a rash. If untreated, it can cause damage to the brain, heart, and other organs. However, it can also be cured by an antibiotic when diagnosed. Regarding fungal STIs, the most common is Candida, also called yeast infection. This fungus usually lives harmlessly on the body, but it can cause infection when present in higher numbers than other types. To cure this fungus, doctors usually prescribe an antifungal medication. The parasitic STIs are caused by organisms which feed on the nutrients of its hosts. Trichomoniasis is found in the urinary tract and causes inflammations on the vagina and urethra in women and men. This condition can be treated with local or oral medication. Pubic lice are tiny lice that reside in the pubic hair of an infected individual and can cause itching and inflammation. They are transferred through close physical contact, such as through sex, but can also be spread via shared items, such as bed linen and towels. To treat the condition, there are special insecticides, lotions, or shampoos. Scabies are caused by small mites that burrow in the skin and lay eggs. Their presence causes their immune system to react, and a rash will often appear in the affected region. They can also be transmitted through close physical contact like sex or shared household items. To treat this condition, usually use a cream or lotion. A viral STI is a sexually transmitted infection that is caused by a virus. Some of the most common viral STIs are HPV, herpes, hepatitis, and HIV. First, let's talk about herpes. It is one of the most common STIs. Most people don't have symptoms, but if a person does have symptoms, they include tingling or burning feeling in the skin or an outbreak of blisters in the genital area or in the mouth and lips. There is no vaccine to prevent herpes and no cure for herpes, but medication can help reduce the number and severity of outbreaks. It is transmitted by kissing, oral sex, and genital-to-genital contact. Hepatitis B now. Hepatitis B can be passed sexually through blood, semen, and vaginal fluids carrying the virus. If left untreated, it can cause liver damage. There is a vaccine to prevent hepatitis B infection, and in the case someone gets infected, the treatment keeps the virus under control. HPV or human papillomavirus is a common viral infection that usually has symptoms. If symptoms do occur, they can take months or years to appear. Some kinds of HPV can cause genital warts and eventually lead to cancers of cervix, vagina, vulva, anus, penis, or throat. Genital warts can be treated by freezing or putting medication on the skin, but the warts may come back. There are vaccines to prevent HPV for both men and women, and they are best taken before a person becomes sexually active. Last but not least, HIV or human immunodeficiency virus is a virus that weakens the body's immune system. Some people develop flu-like symptoms when they first get HIV, but many people have no symptoms. It is possible to live for many years without symptoms but still transmit it to sexual partners. HIV can be passed through sex or sharing equipment for injecting drugs. Only 5 of the body fluids of a seropositive person contains enough virus to infect another one: blood, sperm, pre-ejaculatory liquid, vaginal fluids, and breastfeeding milk. It means that HIV is not transmitted through saliva and kisses, neither sweat or touching a seropositive person. There is no cure for HIV, but there is highly effective treatment that can reduce the amount of virus in the body and help seropositive people live long, healthy lives. Without HIV treatment, the immune system becomes too weak to fight off other illnesses, and it might lead to death. The last stage of the syndrome caused by the virus is called AIDS. Reducing the amount of HIV in the body with the treatment also dramatically lowers or eliminates the chance of passing HIV. That means the faster infected people get tested and treated, if the result is positive, the less chances they have of becoming sick and infecting sexual partners.
So, now that we know more about some of the STIs, let's talk about how to prevent them. Condoms are essential on this matter. On how to use the external male condom, you can watch or rewatch our previous video. Remember that condoms should be used every time you have vaginal, anal, or oral sex in order to prevent the risk of infection. Protections should be used by everybody, not only during heterosexual intercourse. Men who have sex with men, women who have sex with women, and people sharing toys should also pay attention to their sexual health, because they can also get infected and transmit STIs. For oral sex, dental dams or male condoms cut in half can also be used. If you don't have condoms with you, abstinence is definitely the safest option for the moment. As we said before, vaccines are also a safe, effective, and recommended way to prevent some STIs like HPV or hepatitis B. You can check if you have those vaccines with your family doctor or get them prescribed if necessary. Also, get tested. Knowing your status is a critical step in order to prevent the transmission of STIs. If you know you're infected, you can take further steps to protect yourself and your partners. You will be supported by medical healthcare professionals all along. Most STIs are curable if diagnosed. In Romania, you can get tested for HIV in the Direction of Public Health, located in most main cities. For hepatitis B and C, you can get tested with your family doctor. For all other STIs, you will get a note from your doctor to go see a dermatovenerologist. Another option is to get tested in a private clinic, but this might cost you money. The most important thing to remember is that you can go see a specialist in case of any problem. gynecologist for women, urologist for men, and dermatologist, infectious disease specialist for both. You can go for a consultation to any doctor without your parents if you are over 16. But remember that for any medical intervention, you will need your parents' approval if you are under 18.
Okay, now I understand how important it is to be informed and use protections if you're sexually active.
Yes, and also remember to do checkups once every year, plus the vaccine for human papillomavirus and hepatitis.
That's right. Sexually transmitted infections can happen to anyone, and it's nothing to be ashamed of.
Exactly!
Salut! Mulțumim pentru vizionare! Sperăm că v-a plăcut videoclipul nostru. Nu uitați că avem un chestionar distribuit de diriginții voștri. Vă mulțumim celor care l-ați completat deja. Dacă încă nu l-ați completat, vă încurajăm să o faceți, pentru că vom avea un ultim episod în care vom răspunde întrebărilor de acolo și de pe telonim, unde de asemenea puteți adresa întrebări anonime. Toate acestea vor fi disponibile pe grupul privat de Facebook dedicat liceenilor, elevi în Sighişoara, unde vă așteptăm să dați join. Pe data viitoare!